Hello everyone, welcome to pharmacist online coaching. Today we will learn about some important antidotes and their specific uses. These are very important for pharmacy exams and real life medical emergencies. Okay, let's get started. Our first question is, Fomepizole is used in the treatment of, options are iron poisoning, methanol poisoning, opioid overdose, lead poisoning. Can you guess the correct option? Here the correct answer is for methanol poisoning. Okay, let's see why this is the correct answer. Fomepizole works by blocking the enzyme alcohol dehydrogenase. The alcohol dehydrogenase enzyme normally converts methanol to formaldehyde and formic acid. These are the harmful substances. These are the toxic substance which causes serious damage to the body, mainly on optic part. By stopping this conversion, Fomepizole prevents toxic effects such as blindness and severe metabolic acidosis. Okay, then what about the other options? In case of iron poisoning, we can use which antidote? In case of acute condition, deferoxamine is used. In case of chronic overload of iron, we use desferriprone orally. Okay. Then opioid overdose, we use naloxone. In case of lead poisoning, the selection of antidote will vary depending upon the condition of the patient. In case of mild to moderate, we use succimer orally. In case of moderate to severe toxicity, EDTA is enough. But in case of severe toxicity with encephalopathy, we use two drugs combination, British anti-levisite and EDTA. Okay. Then our next question is, flumazenil is the specific antidote for. Options are barbiturate overdose, benzodiazepine overdose, organophosphate poisoning, paracetamol overdose. Anyone get the answer? Here the option B is the correct. Okay, benzodiazepine overdose. Flumazenil is used as an antidote for benzodiazepine overdose. We know that flumazenil works by blocking the benzodiazepine binding site on the GABA A receptor in the brain. This can reverse the sedative and respiratory depression effect caused by benzodiazepines. Okay. Then next question is, which antidote is used for morphine or opioid overdose? Options are atropine, naloxone, protamine sulfate and flumazenil. Do you know the answer? Naloxone is the antidote for morphine overdose or opioid overdose. Okay. Naloxone is an opioid receptor antagonist. It quickly reverses the effect of opioid overdose, including respiratory depression and sedation caused by opioids like morphine, heroin, fentanyl, etc. Okay. Then atropine is used as an antidote for organophosphate poisoning. Okay. Then what about protamine sulfate? Antidote for heparin. Okay. Then flumazenil, you already heard that. And our next question is, deferoxamine is the antidote for. Options are lead poisoning, arsenic poisoning, iron toxicity and copper toxicity. Deferoxamine. We already discussed. What is the correct answer? Answer is iron toxicity. Okay. Deferoxamine is a chelating agent that binds free iron in the body. Then this complex is excreted through urine. It is used mainly in case of acute iron overdose. Then what about for chronic iron overload? We can give orally desferiprone. Okay. Then for the antidote for copper toxicity is penicillamine. In case of arsenic poisoning, we use British anti-levisite. Then lead poisoning we already discussed. Okay. The last question is antidote for cyanide poisoning includes all except. See, the question is antidote for cyanide poisoning includes all except. Which is the except? Options are hydroxycobalamin, sodium thiosulfate, N-acetylcysteine, amyl nitrate. The correct answer is N-acetylcysteine. The others are used in cyanide poisoning. Okay, the hydroxycobalamin, sodium thiosulfate, sodium nitrate,